Hi, I'm Dr. Amy Killen, and this video is about using the mpgun to do scalp regenerative injections. The mpgun has transformed the way that I inject the scalp. I've been doing scalp injections with regenerative biologics for about 10 years, but I found that with this gun, patients often don't require numbing, which is fantastic, and it's just so much more comfortable for them and also, frankly, for me. So part of the pain reduction comes from mpgun's AI integrated technology that continuously measures the fluid pressure, the injection speed, the tissue response in real time, making adjustments as needed for improved precision and efficiency. And while we're injecting more often, in some cases, we're injecting smaller boluses into each spot, which decreases the shear stress generated during fluid flow through the needle and into the tissue, causing less tissue deformation, lower interstitial pressure, and reduced nociceptor activation. Translation: smaller, more frequent boluses can keep pain at a minimum in the scalp. Now, of course, if you're finding that your patients are uncomfortable during those procedures, or especially if you're doing the deeper injections, offering pain control is very appropriate, as we know that it not only improves their experience and likelihood of returning, but probably also improves their outcomes. Hair follicles do not like stress. They don't like vasoconstriction. They're not fans of inflammation. And all of those things can be brought on by pain. So controlling pain is really important. To understand the needle depth settings in the scalp, you should understand the tissue layer depths. So in general, women have slightly thinner skin in the scalp than men, and we're also a little bit more sensitive to pain, supposedly, although I'm not really sure that's correct. The epidermis of the scalp is between 1 and 1.5 millimeters. The dermis is between 2 and 2.5 millimeters. So to get your product into the dermis, we want to generally aim for like 2 to 2.5 millimeters. Now, the scalp follicle goes down into the subcutaneous tissue and reaches an average depth of about 4 millimeters. If pain is well controlled, injecting down to this deeper level may make sense, as well as doing those dermal injections. The scalp mpgun settings are as follows. And again, these are guidelines. You'll want to adjust it based on your patient. Dermal injections, which are your primary scalp injections, depth is between 2 and 2.5. Frequency 0 to 60, and press, you want to start at about 20%. For those subcutaneous deeper injections, which again, totally optional, but something that you may want to do occasionally when pain is controlled, your depth is going to be between about 3.5 and 4 millimeters, frequency 0 to 40, and press, you want to start at about 20%. For the scalp MP pin settings, if you just want to do that needling on top, this is totally optional. I recommend it only for small treatment areas and people who really don't have a lot of hair. It's not something that you can easily do over an entire scalp. But the settings on that, the depth is usually lower, something like 0.5, 1 millimeter, press again, 0 to 5% if you want to try out that dribble method. Now microneedling on the scalp, again, optional. I like to do it in people who don't have a lot of hair. I find it very difficult in people who actually have a fair amount of hair to do needling on top of it as well. And frankly, I'm more likely to use something like a traditional microneedling device if I'm doing a larger area of the scalp than I am the mpgun, because it just would take forever with the mpgun. Whereas a traditional microneedling device has, 5, 10 or so needles and is much faster. All right, let's talk about the procedure itself. Now again, this is the way I do it. You can do it your own way, obviously, but I'm gonna tell you about it so that you can get started. So obviously, you wanna consent the patient, get your good pictures beforehand, and then you wanna prepare your device as we discussed. I like to use the plastic tip with the circle inside for the scalp. And then you wanna prepare your solution, generally between about 3 and 8 mL total, depending on how many passes you're doing and whether you're doing microneedling. So if you're just doing that single intradermal kind of primary pass at 2 to 2.5 millimeters, then you just need about 3 mLs of fluid. And that will cover your kind of normal female, male pattern hair loss pattern. So essentially, temples, front, top, crown. It'll cover kind of all of this. If you want to do a second pass with a little bit of deeper needling, then you'd want another 2 to 3 mLs of fluid. And if you want to do microneedling on top, you're usually going to want to have 1 to 2 mLs of fluid to apply topically after microneedling. If you're just doing like a spot treatment, like you're just doing the temples or you're just doing, a little spot here or there, obviously you can adjust your fluid volumes appropriately. You can also do things like eyebrows, which is kind of fun, and obviously do not need very many mLs at that point. So TLDR on the scalp, a volume of up to 8 mLs would be necessary if you're doing multiple passes, example, dermal injections and subcutaneous injections plus microneedling. But in most cases, you're just using about 3 mLs of product. So the next step is to prepare the patient. You can do it with the patient sitting, you can do it with a patient lying all the way back supine. I'll sometimes even do it prone if I'm just getting the back of the scalp primarily, depending on the areas you're injecting. You want to drape the patient, protect the clothes. This is a clean procedure, not a sterile procedure. You want to clean the scalp with your solution of choice, like chlorhexidine, 2 to 4% in like 70% isopropyl alcohol, or you can just use 7% isopropyl alcohol alone. When it comes to preparing your patient for scalp injections, one of the most important things to do is to set realistic expectations with him or her. Make sure they understand that while we do have studies, especially with PRP, but some with exosomes, some with stem cells, that we can increase both the density of the hair follicles and the number of hair follicles. It can take time, up to 3 to 6 months, and not everyone, unfortunately, benefits. About 80% of patients seem to benefit from these regenerative treatments of the scalp. And, frankly, I think that the things like exosomes and stem cells work better in my experience than like PRP, but you do want to set realistic expectations. A series of 3 treatments is going to have better benefits than just doing 1 treatment. And then also I recommend to the patient doing all the other things at home are going to make a big difference. So do the red light therapy, do the other topical serum at home, do the reducing your stress and improving your lifestyle and reducing UV damage to your scalp, and do all the things if you really want to have improved hair growth over time. So set those realistic expectations so that there are no surprises. Make sure you have good instructions for home as well. And then it's time to start the procedure. If needed, have an assistant. It can be really helpful to have someone with a comb to kind of create a part in the hair for each treatment area, and then you can just kind of zip along that part with the gun and then just kind of keep creating new parts. This is if you have someone who has a lot of hair. Obviously, if they're bald, then it's much easier. Again, keep the device mostly perpendicular on the skin at all times. Injections should be, about 0.5 centimeter apart. Part of this, again, depends on how big your treatment area is. If you're doing a smaller treatment area, you can certainly have your injections closer together, and you're going to be essentially going in a grid-like pattern on the scalp. The intradermal injections are usually pretty well tolerated without any numbing. However, if you're doing the deeper injections, like 3 or 4 millimeters, then some numbing, either topical numbing, nerve blocks, etc., may be a good idea. And then again, you can do the MP needling afterwards, either with the gun or you can just do microneedling with another device and apply that regenerative solution after the needling as well. At the very end of the procedure, I like to make sure that there's not any blood on the scalp, that they don't look like, a crazy zombie when they leave your clinic. But I do like to leave those regenerative products or solutions on the scalp because we know that exosomes, for instance, will continue to absorb into the skin for up to 18 hours after we apply them. Home instructions and follow-up will depend, of course, on what you're injecting, but in general, I like to leave that solution on at least a few hours. I usually have them try to wait to take a shower till the next day, although that is, up to you. I always give them a recommended topical daily product for home as well. That could be a peptide solution, it could be your favorite hair solution, something to apply every day. I also will give my patients Rapid Rebound, which is the peptide capsules that contain BPC-157, AOD-9604, as well as PEA, which is an anti-inflammatory. They work great for skin and scalp. I'm also a big fan of red light therapy, so photobiomodulation caps, like the ones that they wear 3 to 4 or so days a week. We have good evidence for those things, and I really think that they are beneficial in addition to your scalp injections. And then finally, I prefer to do 3 treatments with these kinds of scalp injections, usually spaced about 4 to 6 weeks apart. Have them come back in 4 to 6 weeks, and then you do that second treatment. That series of 3 will give you better results than just doing 1, obviously. When it comes to using the addusomes for skin or scalp, these are, of course, the adipose-derived exosomes. I like to use a dilution of about 3 to 4 mLs of the diluent into those lyophilized exosomes. So what this means is that I can do a scalp procedure with 1 vial in most cases. I can do a face procedure with 1 vial in most cases. And of course, if I want to do a more serious procedure with multiple different depths of injections or different types of injections, then maybe I'm using 2 vials instead of 1 vial.